Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to all of you. So today our group will sharing about the narrative therapy. So this is our group members, and what we are discussing for today is the number one is sketches of leading figure. The second one we will discuss about the theoretical formulation. The third one is we going to learn about the goal of the therapy, and the fourth one we going to know about the roles of counselor in this therapy, and the fifth one is the assessment and therapeutic technique, and the sixth one is evaluating theory and the result, and number seven is about the strength and weaknesses on this theory, and we will do some case study, and the last one we will discuss about the Islamic perspective in this theory. Okay, alright. Now I'm going to discuss, or I'm going to share with you the sketches of leading figure in this narrative therapy. There are two figure leaders. Is the first one is David Epstein. The second one is Michael White. Okay, for the first one, the leading figures is David Epstein. He was born in New Zealand in 1944, and he worked as a social worker, primarily in the child and family welfare sector. And his work is focusing on analyzing problems, reautering narrative, and helping clients construct a more empowered story about their life. And he also have several or become co-author in narrative therapy with Michael White. Okay, so now we are moving to the Michael White. Michael White is born in South Australia in 1948. So while initially worked as a youth worker, and he also engaging with young people in and their families. And then later he became a family therapist working in various clinical and educational settings. And then White started incorporating narrative concept into this therapeutic practice, eventually co-developing narrative therapy alongside David Epstein. So we can see that two both of figures cooperation in this narrative theory. Okay, now we are moving to the theoretical formulation. The first theoretical formulation in this narrative theory is narrative as the central elements. It means that the client construct their identity and understand the world around them through the story they tell about themselves and their experience. One of the example that I can give to you is maybe one client named Sarah is struggling with feeling of low self-esteem and anxiety. Through narrative therapy, Sarah and her counselor explore the story she tell herself about her self-worth and her anxiety. And then after that, they examine how her self-esteem narrative has been shaped by their past experience and the cultural message that she encounters. Okay, number two, the theoretical formulation is externalization of the problem. This means it involves separating issue from a person identity and viewing them as external entities. It's mean by externalizing problem, client can gain perspective and see this issue as separate from their core identity. I can give you for example, Johan, a teenager, is experience anger issue. So in this therapy, the counselor help him externalize his anger by naming it maybe like the anger monster. This allows Johan to see his anger as something separate from his problem and open up to this possibility to addressing it more effectively. Okay, the third theoretical formulation in this narrative theory is about the reautering narrative. It means that client work with the counselor to construct a new narrative that align with their preferred identities and value. This process allows the client to take an active role in rewriting their life story. For example, maybe the client have a narrative about being a failure due to the past academic struggle. So in a narrative therapy, she worked with her counselor to re-alter her story. So they explore instances and of resilience and the success in herself, helping her construct a narrative that align with her preferred identity as a capable and determined individual. Number four, the theoretical formulation in narrative theory is the deconstruction and reconstruction. It means here that clients explore how certain narratives contribute to their difficulties. Once problematic narratives are identified, the client can reconstruct their story in more empowering ways. For example, I can give you here is about the client who has a narrative that he is unlucky because he has experienced several setbacks in his career. Through narrative therapy, he deconstructs his narrative by examining how it's influenced his self-perception decision, and together with his counselor, he reconstructs a new narrative in emphasizing his strength and adaptability. And number five, the theoretical formulation is about collaborative approach. This means here the counselor and the client work together as equal partner to explore, challenge, and reshape a narrative. The counselor use narrative informed question to facilitate this collaboration process. So, for example, maybe the client seek a therapy for relationship difficulties. Her therapist take a collaboration approach, engaging in a dialogue with her rather than providing direct advice. The therapy use narrative informed question to help the client to explore her experience or his experience and perspective, and allowing her to construct a new relational narrative. The sixth point in theoretical formulation in narrative therapy is cultural and contextual sensitivity. This means the counselor take into the consideration a variety of culture and social factors that affect the client narrative. For example, maybe one of the client is a transgender individual is navigate the challenge of coming out to their family. So in narrative therapy, the counselor acknowledge that the impact of the cultural and societal narrative to the client experience. So they work together to explore how the cultural narrative about the gender and the family influence the client personal narrative. And the last one for the theoretical formulation in this therapy is postmodern and social constructionist foundation. The narrative therapy is based on postmodern and social constructional idealism, which emphasize the importance of language and discourse influencing our perception in reality. For example, maybe the client is dealing with a grief following the loss of a loved one. So his counselor used a postmodern and social constructional approach, emphasizing that there are multiple ways to construct a narrative about the grief that explore various cultural and personal narrative related to coping with loss. Okay, now we are moving to the goal of this theory. The first goal of this theory to realtering the narrative. The narrative therapy seeks to assist the client in realtering their life story. The client are encouraged to reconstruct their narrative in a manner that aligns with their preferred identities, values, and goals. This process allows individuals to take an active role play in shaping their own story. Okay, for the second goal is to externalizing the problem. The counselor aimed to externalize issue and challenge by separating from a person identity. By reviewing problem as external entities, individuals can gain a sense of perspective or control over this issue, making them more management. And then for the coping and resilient, for the client maybe dealing with some traumatic issue, the therapy aim to help them construct a narrative that emphasizes resilience and coping strategy. This can provide a sense of hope and strength in their face of adversity. Okay, for the third goal in this narrative therapy is deconstruction of the problem saturated narrative. Narrative therapy help client to deconstruct problem saturation narrative that contribute to their difficulties. Clients are encouraged to examine how a certain narrative shape their self-perception and decision-making. Through this process, they can gain insight into how this narrative influences their life. The goal number 4 for this narrative therapy is cultural and contextual understanding. It means here the therapy acknowledge the impact of cultural and societal narrative on personal story. It encourages clients to consider the broader cultural and the social context that shape their narrative, promoting a deeper understanding on how this context influence their experience. For goals number 5 in narrative therapy is collaborative exploration. It means here narrative therapy emphasizes as a collaborative and non-pathologizing approach. The client and the counselor works together as equal partner in exploring, challenging, and reshaping the narrative. The therapy uses narrative informed question to facilitate with collaboration process. And for the last goal in this narrative therapy is to empowerment and self-agency. A significant goal of narrative therapy is to empower clients by helping them recognize their agency in shaping their life story. Clients are encouraged to take an active role in constructing narratives that align with their peripheral identity and values. And I think that's all from me. I will pass to the next presenter.
Okay, so we proceed with the role of counselor. The first role is counselor should separate the person from his or her problem. Narrative therapy is a form of therapy that aims to separate the individual from the problems, allowing the individual to externalize their issue rather than internalize them. It relies on the individual's own skill and sense of purpose to guide them through the difficult times. Secondly, counselors should help clients construct a preferred alternative story. Constructing alternative story is a key process in narrative therapy that involves collaborating with client to explore and expand their preferred narrative, challenge dominant or oppressive stories, and identify new possibilities and meanings. This helps clients to reinforce their new identity and agency and to share their stories with others who can support and validate them. Next, counselors should create a collaborative relationship. Collaborative relationship is a client-centered approach that places the emphasis on collaboration, honesty, respect, and empowerment for both therapist and client. By working together as partners in the therapeutic relationship, clients are able to engage in meaningful conversation about what they want to change. Next, counselors should create a collaborative relationship. Collaborative relationship is a client-centered approach that places the emphasis on collaboration, honesty, respect, and empowerment for both therapist and client. By working together as partners in the therapeutic relationship, clients are able to engage in meaningful conversation about what they want to change. Lastly, Counselor should be an active listening, empathetic, summarization, and paraphrasing. Paraphrasing or active listening, which is coined by Carl Rogers in client-centered therapy, is a form of responding empathically to the emotion of another person by repeating, in other words, what this person said, while focus on the essence of what they feel and what is important to them. Next, we continue with the assessment and therapeutic technique. As a counselor and as a therapist, our job in narrative therapy is to help clients find their voice and tell their story in their own words. The first commonly used technique is telling one story, which is putting together a narrative. According to the philosophy behind narrative therapy, storytelling is how we make meaning and find purpose in our own experience, which is from Standish in 2013. This technique is known as reauthoring or restoring. It allows clients explore their experience to find alteration to their story to make a whole new one. And also, it allows the client to express their thoughts and explore events in their life and the meaning they have places on this experience. So, with helping the client develop their story, it will give them an opportunity to discover meaning, find healing, and establish or re-establish an identity, all integral factor for success in therapy. After that, the technique is called internalization technique. This technique leads to client towards viewing their problem or behavior as an external instead of an unchangeable part of themselves, a technique that is easier to describe than to embrace. It can bring huge positive impact on their self-identity and confidence. The general idea of this technique is that it is easier to change a behavior you do than to change a core personality characteristic. After that, counselor can utilize the deconstruction technique. This technique is an excellent way to help the client dig into the problem and understand the foundation of the stressful event or pattern in their life. This deconstruction refers to reducing the problem a client is experiencing, making it easier to understand the whole picture, and the problem can feel overwhelming, confusing, or unsolvable, but they're never truly unsolvable by Bishop 2011. So deconstructing makes the issues more specific and reduce overgeneralizing. It also clarifies what the core issue or issue actually are. The last one of a therapeutic technique is unique outcomes. This technique is complex but vital for the storytelling aspect of narrative therapy. The unique outcomes technique involves changing one's own storyline. In narrative therapy, the client aims to construct a storyline to their experience that offers meaning or give them a positive and functional identity. This is not as misguided as a thinking positive, but rather a specific technique for clients to develop life-affirming stories. Okay, so let's move on to assessment part. There are some exercise and activities that is suitable for this narrative therapy. The first one is statement of position map. This simple handout consists of 4 areas for the client to write. The first one is characteristic and naming or labeling the problem. The second one is the client should mapping the effect of the problem throughout each the domain of their life. For example, home, work, and relationship. And then the third one is evaluate the effect of the domain, and the last one is values that comes up when thinking why these effects are undesirable. Generally, the dialogue between a therapist and a client will devolve into these 4 areas. The therapist can ask questions and probe for the deeper inquiry, while the client discusses the problem they are having and seek insight in any of the 4 main areas above. So there is power in the act of naming the problem and slowly shifting the idea that we are a passive viewers of our life. The second assessment that the therapist can do is about my life story. So the client can find a meaning and healing through the telling stories. The intention for doing these life stories is to separate client from his or her past, and they can gain broader perspective in life. And then the third one, it also aim to create outline of their life, which does not revolve too intensely around memories. And the last one for assessment is expressive art. Basically, expressive art is very important assessment in narrative therapy, because they have many types of art that can express the client's feelings. The first one is through journal. So the client can choose to do a journal, which is she or he can consider a specific set of questions. For example, like I put in the slide, how does the problem affect me? That's the example. And then the second one is from drawing. So the client can express her emotion, her feeling through the drawings, because it allows the client to depict or to giving a pictures the problem impact on client experience. For example, client can choose and create a cartoon that they like, which represent the problem in their life. And then the last one is visualization. This type of assessment can be used in to consider how life might be in a week, in a month, or a year ahead. The client can imagine and visualize what she or he will be in the future ahead. For example, they can reflect in their journal to explore ways to help them find meaning on their life, this is from Freeman 2015. So I think that's all from me. I will pass to the next presenter, Aishah.
Assalamualaikum warahmatullahi wabarakatuh. My name is Aishah An Nur Fitri binti Parman, metric number 2012190. So now I will proceed to the presentation under evaluating of theory. We have advantages of theory and also disadvantages. So for advantages of theory, we have identified 3 advantages of narrative therapy in family counseling. First is respect. This therapy is very respecting client point of view and their bravery it takes to come forward and work through personal challenges. Okay. Second is non-blaming theory, which is the therapy focuses on separating individuals from problems and uniting the family to fight against the problem and encourage them not to blame on each other. And last but not least, client as the active author. What it means by client as the active author is whereby therapists are not viewed as an advice-giving authority, but rather a co-author that empowering the client to become an active author of their own life or problem. Second, disadvantages of theory. We also have identified 3 disadvantages of narrative therapy in family counseling. First is therapy can be very in-depth and challenging for client to work on. Second is viewing problem as stories to be deconstructed, overlook the fact that some family have their own conflict, their own and real conflict that don't disappear. Third is in restoring or reauthoring techniques. Okay, therapists often subscribe unhappy emotion such as anger, sad, depression as annoyance rather than to avoid explore. Okay, so next we proceed to the case study. Okay, a case study of narrative therapy is related when a patient experienced their father walking out of their family as a young child. They were left to take care of their mother, who blamed the child for their father's actions. So this one incident told the child to think that they had to take care of others and they were unlovable because of so as a child or young adult, I think description like this can control the emotion and the entire life. So whenever the child is experiencing rejection, they will tell themselves that they are unlovable, and as they grow up and seek out of the romantic relationship, they often tell themselves that the only way to keep their partner around is to take care of all their needs. So if they try to ask for any support or do anything from themselves, the partner will eventually leave. So the client will see this as virtue evidence that they are unlovable. So, therapists and counselors help the client and patient create narrative so that they can step out of their story and view it from an outside perspective. So, this technique is called externalizing. So next, for the intervention for the case study is we use two type of intervention, which is externalization and also deconstruction. So for externalization, if you grow up telling yourself that you are unlovable, you are going to unconsciously stick to that story. So but you have to think about this. What if your best friend were to tell you that they were unlovable? What if a random person told you that they are unlovable? So you will probably think they were being ridiculous. So now put yourself in other people's shoes. So it's called externalization. So next is deconstruction. A therapist may, for example, look at the incident that appears to start it all. It's like a reset button to the client. So they may talk to their patient or client specifically about the moment. For example, in this case study, the moment when their father left them. So the counselor or the therapist will deconstruct from the very bottom of the story. So as a result, through writing the narrative, externalization, and destruction, client will start to see different outcome for themselves. They will see that they are capable of growth and change. Breaking down a thin description prevents it from steering them onto one path. So the end goals of this approach is to show the many possibilities that client have for the future. Next, we move to the Islamic perspective. So basically, this is from hadith related, which we think that is related to the narrative theory. It's stated that whoever loved the meeting with Allah, Allah too loved the meeting with him, and whoever hates the meeting with Allah, Allah too hates the meeting with him. Actually, this hadith is related to positive thinking. Positive thinking is so important in Islam that is emphasized at the time of death. Muslims should not only think good about the Creator, they should think best of Him. This is especially important at the same time of death, that believers be encouraged to focus on Allah's mercy and forgiveness. The next hadith is related to Prophet Muhammad, in which he stated that God says, Allah says, I treat my servant in accordance with his opinion of me. So it's much related to the previous hadith, which is the main point. Islam encourages optimism and a positive outlook on life. Muslims are encouraged to have faith in Allah's mercy and blessing, and to trust in Him, in His plan, even in difficult situation. Muslims also believe in the power of prayers and supplication, giving them comfort and optimism. I know when we have been facing some difficult time in our life, it is very hard for us to think positive, but somehow Allah mentioned that He treated the servant according to what opinion of us towards Allah. So we should and we have to always think positive towards Allah, and by prayers, by dua, so that Allah will ease our journey. And it is related to the narrative story, whereby actually when we put ourselves in other people's shoes, we cannot be negative at all because we don't know the story, the full story. So narrative story is like our life. We are the one who narrated it. We are the one who author our own story. So we should be positive. So in a conclusion, this therapy can be very in-depth, exploring a wide range of factors that can influence the development of the stories. It focuses on talking about problems as well as strengths, which may be difficult for some people. So the therapist's role is important as it helps to explore client's story and discover how it may be contributing to the emotion distress, as well as uncover strength that can help to approach client problems. That's all from our group. Thank you.